And welcome to the 15-minute Matrix excerpt talking about fasting by Krista Verde. Hope you enjoy.
So the main type of intermittent fasting I study is alternate day fasting, and that involves basically a 500 calorie fast day alternated with something we call a feast day, and that's where people can truly eat whatever they want. And so the diet kind of just flip-flops like that: fast day, feast day, fast day, feast day. And I've run about 12 studies in that area. And we found that it definitely works quite well for weight loss. That's our main outcome, actually. So people tend to lose, and the average, I guess the range would probably be anywhere from 20 to 50 pounds in about 6 months or so. And we've also shown improvements in metabolic disease risk factors, like it also decreases LDL cholesterol, triglycerides, blood pressure, insulin, and insulin resistance. Those are some of the main things that we've seen like coming out of our lab. There's been actually not that many studies until recently. For some reason, intermittent fasting, was kind of like completely ignored up until probably like 5 years ago, honestly. And now there's this like storm of studies coming out. I mean, I have to like review studies all the time. Most of them are in the same area and they're kind of supporting those changes in metabolic disease risk. There are some studies coming out. It's not really my area, but they're trying to examine cancer risk and more of the mechanisms with that. So those are some of the newer studies coming out, but we're still waiting on the results for that.
Interesting. So let's talk a bit about some of those differentiators that I heard you speak into. You talked about intermittent fasting and you talked about the difference with periodic fasting. If I'm getting that right, you can correct me if I'm wrong, but you just spoke into one of the areas, which was the alternate day fasting, the fasting feasting model. But what about other forms of intermittent fasting?
So intermittent fasting, it's a little confusing, but it's an umbrella term for 3 different types of fasting. The first one is the one that I already talked about, alternate day fasting. So again, that's 500 calories one day and then feasting the other day, and that kind of flip-flops. And then the second type is 5-2 diet, which is actually really popular in the UK, but not so popular here. And that's basically just 2 fast days a week. So the 2 stands for 2 500 calorie fast days per week, and you can put those fast days wherever you want. And then the 5 means 5 feast days per week. So it's kind of like a slightly easier form of alternate day fasting. And then a more popular form of intermittent fasting, or I'd say like the most popular one now, considering just the amount of people that ask me about it, is time restricted feeding. That's basically when you limit the window of eating to a certain period every day. So a lot of people like to choose an 8-hour window. So really that's like, just to put it in more basic terms, that's when you basically just eat between, let's say, 10 a.m. to 6 p.m. every day. And you don't have to count calories. You don't have to like count carbs or anything like that. You really just consume all of your food within that window. And then the other 16 hours of the day, so that would be past 6 p.m. up until 10 a.m. the next morning, you just consume water, or you can also do like calorie-free beverages like black coffee or black tea. Those are the 3 different types.
So one of the specifics that I've heard you speak into, at least for 2 of them, the alternate day fasting and the periodic fasting, is the amount of calories that you have on your fasting versus your feasting day. So it actually isn't water fasting. It is a low calorie day, which is, as I understand it, about 500 calories, or maybe with the periodic, even a little bit more during the fast days. Can you talk into that?
So we discussed intermittent fasting. So there's those 3 types, alternate day fasting, 5-2, and time restricted feeding. And then periodic fasting is kind of its own thing.
Got it.
It's like its own, I know it's super confusing actually. It took me a while to even straighten it out in my head, honestly, at first. But periodic fasting is a totally different type. And that's when you fast for the first 5 days of every month and you consume approximately 700 calories to about 1,000 calories. And with that diet, it's a low protein diet, so it's around 10% or so. And that diet's been studied really heavily, or I think it was actually created by Dr. Walter Longo at the University of Southern California. And he does a lot of kind of like cancer and mechanistic research with that diet. But so 5 fast days at the beginning of every month. And then the other 25 days of the month are basically just do whatever you want, feast days.
Right. So this is where clinicians may bristle a little bit, at least the clinicians ones that are fans of this podcast with the do whatever you want, but I just want to get us into the concepts here. And to reiterate, just because I confused it, there's the intermittent fasting versus the periodic fasting, and the intermittent fasting includes the alternate day fasting, the time restricted fasting, and the
5-2, yeah.
the 5-2. Okay,
That's right.
great. Thank you for clarifying that. And then what I'm really curious about is, why do you think the time restricted fasting has been the one to take off in popular understanding and research and implementation versus the others? Does it have more results behind it in the research, or what's your analysis of that?
Oh, it's actually the opposite. Where time restricted feeding at this point has maybe 5 or 6 clinical trials, and most of them just started coming out in the past like 3 years or so. So it's definitely the newest form. I think it's become the most popular because it's the easiest one to adhere to. We've run a couple studies of time restricted feeding, and we found that weight loss is actually slower. So people lose about half the amount of weight they would with time restricted feeding compared to alternate day fasting. But people like time restricted feeding a lot more. So they just find it a lot easier to incorporate into their lifestyles, which I think is a really important factor of any diet, something that people can kind of maintain. It's got good feasibility. So I think that's why it's so popular. Whereas with alternate day fasting, some people really like it, but they really struggle with it because you really have to just like limit yourself to 500 calories every other day. And it's hard to socialize with alternate day fasting because then, what happens if your fast day falls on like a birthday party or something like that. So
Right.
in time restricted feeding, there's a bit more flexibility where you can like move the window around to accommodate certain things. But yeah, so I think that's why it's kind of grown in popularity so much.
There were two things that you spoke about when I heard you at the conference, which I'd like to look at a little bit more in terms of outcomes and understand if they're related to any of these types of fasting or if they're related to one of them. And the first of those was the weight loss that occurred just with some of the slice out of the time. So weight loss, let's say with the time restricted fasting, you mentioned that even cutting out 4 hours of feeding time aids weight loss alone. And the hypothesis there is it's a caloric implication. Can we talk a little bit more about weight loss across the different types of fasting and what you found in the studies?
Alternate day fasting in general, just to kind of summarize it before I really jump into everything, it seems to produce probably like twice the amount of weight loss. So people will lose, let's say 2 pounds per week with that diet, whereas time restricted feeding, it's probably more like 1 pound per week. But then again, it's like time restricted feeding is slower weight loss, but people find it easier to stick to. Whereas alternate day fasting is probably faster weight loss, but people really struggle to stick to it for a long time. So those are, definitely two things to consider when prescribing this type of diet. So alternate day fasting, it really depends. Like bigger people will lose weight much faster. We've seen people lose, 3 to 4 pounds per week if, people have like a BMI over 40 with alternate day fasting. Time restricted feeding, what you're talking about with the calorie deficit. So what we've noticed in our trials, and other people have noticed this too, it's probably the most fascinating thing with time restricted feeding. Remember, it's just a window of time. So you pick like a 6-hour or 8-hour window every day, but you don't need to count calories. So all you have to do is look at the clock. And what we found, and some other people, is that there's this like unintentional calorie restriction that's produced. So people tend to lower their calorie intake by about 300, 350 calories per day by just limiting their eating window to 8 hours, which is amazing because, people get really sick of like writing stuff down in food records or recording stuff in apps and that type of thing. So, all you really do is you just have to watch the clock and you kind of get this natural calorie restriction, which then produces weight loss.
Amazing. What about insulin production? What have you found in the research related to fasting and insulin production?
Yeah, so what we've seen just in general, the main thing that seems to be affected by fasting is insulin. So fasting insulin levels tend to decrease by about 20% individuals with obesity. It goes down a little bit more. We've also tested this in insulin resistant subjects, and it actually goes down by about closer to 40%. So our next step, we really want to see what happens type 2 diabetics to see if basically it helps control glucose and insulin and whether or not people can stop taking medications or if it decreases medication use with that. But yeah, definitely. And we've also seen insulin resistance go down as well after it takes about 4 weeks or so for these changes to occur. After 4 weeks, we see really nice decreases in both insulin and insulin resistance in the more like pre-diabetic or just healthy population.
So I want to take some of what you're talking about in the research into sort of the clinical realm. When you're working with the subjects to do the research that you're doing or to explore the research that's been done, are there people for whom fasting is not appropriate that's been discovered in the research?
Yeah, so I would definitely not recommend it for pregnant women or women that are lactating, like breastfeeding. It's definitely not good for people with binge eating disorders. Those people tend to overeat on the feast day. So that's obviously a
Right.
problem. And then there's no studies yet in type 1 diabetics. I don't know if it'd really be useful in that population. And then shift workers also have a really hard time following the diet.
Really good point. So we consider who the person is from certain perspectives. If you were to be able to speak to clinicians in the way that many of us are using intermittent fasting, is there anything you would caution?
I would say, well, it's become so popular over the past I mean, I think it's really just the past year or two that I would say definitely read the research. Obviously, physicians have access to PubMed. There's a lot of like super inflated things being said now. There's just, so many blogs and stuff like that. So I would definitely, go back to the research, read the systematic reviews to see what's actually been shown. Because there's a lot of things out there saying that it like cures cancer or that it extends lifespan and that type of thing. It's got all these anti-aging effects, but none of that stuff has actually been shown. One of the major things that kind of bother me right now is that people believe that the mechanism of fasting and like the reason that it has all these benefits is from autophagy. So autophagy generally it just means self-eating. And it's basically when the body kind of looks inward on itself, and it's during periods of fasting, so periods when there's no nutrients coming in. And then the body kind of has this time to like heal itself by basically like literally consuming cell components and cells that are just basically malfunctioning. And this has been shown in yeast, but it's never been shown in humans. I don't think it's even been shown in like rodent models at this point. So at this point, we really don't know what the mechanisms are. And there's a lot of like inflated there's basically anything around like longevity and anti-aging. None of that stuff has actually been proven.
Right, which doesn't mean we can't make a correlative leap, right? But it's not proven yet. So I think that's important to note what you're saying, which is why I was so excited to hear you speaking, because it's this understanding of how we use research in our clinical
Yeah.
interventions, and some of it's okay clinically to try something correlative, but without the promise that it does that. My final question for you, Krista, and I so appreciate everything you're bringing forward. Side effects, any that you've seen with intermittent fasting, things that aren't wanted? The things that come up for me as a clinician, just to feed into this, is that so many people are trying it and they're inducing a level of stress that impacts other hormonal function. It impacts their sleep. It impacts their stress and resilience. Of course, that's not in the research. It's just something I'm seeing. In the research, is there anything that's a side effect?
Yeah, with alternate day fasting and time restricted feeding, I do have to say the first 10 days are pretty difficult for most people. We see the most dropouts in that time. But if people can kind of make it through the first 10 days, then they tend to stick to the diet pretty well after that. The main thing we see is actually headaches, and that comes from people not drinking enough water, like basically on the fasting days. But once they up their water intake, the headaches tend to go away. Other things, people definitely, there's a little irritability in those first 10 days. The whole like hangry effect definitely happens, but people kind of habituate to the diet and that goes away as well. There has been some cases of mild constipation. which also tends to go away with a bit more water and fiber intake.
Beautiful. Thank you so much, Krista. I really appreciate you bringing forward the research, kind of setting the record straight on something that's gone a little bit haywire in a fad. I'm not saying it's good or bad. I just think we have to be aware of research versus clinical intervention and where we conflate the two. So I really appreciate your perspective.
Did you get some valuable information out of this podcast? I hope so. Talk soon.